According to the Kaiser Family Foundation, a nonprofit organization that focuses on health policy, an estimated 10% of people need fertility assistance to have a child. Senator Erin May Quaid is the author of a bill that would require that Minnesota insurance companies include coverage for infertility treatments in their health plan offerings. She joins me now in the studio. Thank you for being here.
Thanks for having me.
There are a number of reasons why people may seek fertility treatment. In vitro fertilization, or IVF, is probably the most commonly recognized treatment, but the subject area is actually broader than that. What are some other reasons that people seek fertility treatment?
That's a really great question. So some people seek fertility treatment because they can't have a child through P and V, as we call it, penis and vagina sex. Sometimes they do it because they want to be a single parent by choice. Sometimes because of past illness like cancer and they've had to use fertility preservation. Sometimes because of genetic disorders, and so they have to go through the IVF process to pre-test embryos to make sure they're not passing on things that could be life-threatening or life-ending for their future children. And so there are so many reasons why people use fertility services, and we wanted to be sure in this bill that it covers all of those reasons.
In March, Axios Twin Cities put together a list of some of Minnesota's biggest companies and the fertility benefits that they offer. So, for example, Best Buy supports adoption and surrogacy-related expenses, offers $10,000 for fertility treatment services, and up to $5,000 for pharmacy costs. Blue Cross Blue Shield Minnesota offers a $25,000 maximum for fertilization and cryopreservation, which is freezing eggs or sperm. But there is no standard, and many other insurance companies offer little or no coverage. Is establishing a standard for coverage part of the intent of this bill?
It is, and we want to be sure that every person, these large corporations have recognized what we know here at the legislature, which is every person should be able to start or grow their family, regardless of their income, their race, their gender, their zip code, their relationship status. And so we want to be sure that every person has this available to them, and it's not just a perk of a job that you have.
Some states already require health insurers to cover some costs, but significant gaps in coverage remain. In fact, for many, fertility care is often inaccessible due to cost, or people are simply going into debt in order to start a family. If your bill becomes law, would starting a family become an affordable option for everyone, including people on medical assistance?
Absolutely. This bill explicitly includes people who are on public or private insurance because we don't want to create those inequities through our laws that already exist in the insurance system. We want to be sure that every person has the right to have a child if they want to become a parent.
Now, in your bill, is it a limited benefit, like a certain number of treatments or a certain cash allowance? I know that this may change as the bill moves forward, but in general, is there a level where the coverage does stop?
No, but that's because usually there is a level to which people will stop, and we don't want to put an artificial limit on what people can choose to go through. It is a very arduous process to go through IVF, to go through IUI, to go through fertility preservation, and so there are limits that both providers, doctors, and people have, and we didn't want to say this is the blanket limit for every person because it's going to differ from person to person, family to family, issue to issue, reason to reason.
The Kaiser Health document that I referenced in the introduction states, quote, fewer Black and Hispanic women report ever having used medical services to become pregnant than white women. This is a result of many factors, including lower incomes on average, as well as barriers and misconceptions that may dissuade women from seeking fertility assistance, end quote. So is this also an equity issue in your view?
It absolutely is an equity issue. We listed some of the wonderful companies who are providing this assistance through their benefits program, but we know that these benefits do not trickle down into the jobs that people with lower incomes typically have, people who are Black and Hispanic and Asian and Latina typically have, people who are single, LGBTQ people. This absolutely is an equity issue, and we know that if money is the way that people are currently accessing fertility services, then it's people with money or people who have access to people with money that are able to do it, and that's going to typically leave out people who are lower income, people of color, LGBTQ people, people who have gone through serious medical issues, people who live in rural areas, and so we want to be sure that we are not creating those inequities in our bill and covering every person.
So fertility treatments can be quite costly. Is mandating coverage likely to raise rates for everybody?
That is a great question, and the answer is no, and there's a few reasons for that. One, it is costly to go through fertility services as an individual, but it's not costly if you spread that across an insurance pool. The number of people who are of a reproductive age and who want to be parents is quite small when you talk about the actual population in the state of Minnesota. And so, you spread that across, an insurance pool, and we don't see rates go up. A cost for fertility services could run anywhere from $10,000 to $50,000. That could be an appendectomy, an MRI, or an X-ray, right? So we're really talking about a cost that often the insurance pool bears, but that individuals often don't, right? We're not often paying for our own MRI. So we've seen in other states that insurance rates have not gone up, and that is the really good news. We're actually pairing fertility coverage in this bill with prenatal and maternal health care, and that's where we find that parity, is we're just putting it all together and covering it in the same way.
The Star Tribune reported recently on couples who have maxed their credit cards or taken out a second mortgage on their home in order to start a family. If this bill becomes law, then they would be helped, but so would a single person, as you've said, or a same-sex couple who want to start a family. In essence, with this bill, is it stipulating that there is a right to family formation, regardless of a relationship status or a person's gender?
Absolutely. I've talked before on this program about how I'm a reproductive justice advocate, reproductive justice being a framework that was created by Black women in the 90s. And there are 4 primary principles. The first one is the right to have a child. And in this country and in our state, if you can't actually afford to start your family, then you don't actually have the right to have that child. And so we are creating laws around that first principle of the right to have a child. We want Minnesota to be the best state to have a child, raise a child, and raise your family, but it starts with people being able to actually have those children.
And so in what you just said then, is that how you would argue then that it is in the state's interest to make sure that anyone who wants to start a family can?
Absolutely. We want parents, or people who want to be parents, to be able to become parents. We want people to enjoy parenthood and be able to experience that. We don't want to force people to become parents, but we want people who want to become parents to be able to. And cost, quite honestly, is getting in the way for a lot of folks, and we want to remove that barrier and make Minnesota just a great place for all families.
Senator Erin May Quaid, it has been a pleasure. Thank you.
Thank you so much.